Premier Ford announced today that the Ontario stay-at-home order will remain in place until at least June 2nd. Previously, the Ford government imposed restrictions on outdoor amenities under the Reopening Ontario Act. Since then, there have been multiple calls from politicians and the public to ease these restrictions, including by Brampton Mayor and the province's own Science Advisory Table. In fact, this Monday, the Toronto Board of Health voted unanimously on the motion to urge the Ford government to lift the ban. However, the provinces insist that these outdoor amenities will remain closed until cases significantly decline, so as to discourage mobility. Many opponents on this ban argue that the restrictions do little to curb COVID-19 and will have disproportionately negative impacts on children who are unable to access green spaces. I'm joined with NDP MPP Sara Singh to reflect on these issues. Welcome, MPP Sara Singh. How do you see Premier Doug Ford's announcement today to maintain Ontario's stay-at-home order in place until at least June 2nd?
I think it's another disappointing announcement for many people here in the province of Ontario. I think what is really frustrating for a lot of folks is that we see lockdown after lockdown, but yet, the government and Premier Ford really failed to follow public health recommendations. Still in the province of Ontario, workers have access to a very limited paid sick day program. It would have been great to see that program amplified today. Also, lots of frustrations around the vaccine rollout and making sure that our communities are getting their fair share of vaccines here in Peel and across Brampton. None of these sort of pieces tied to the announcement to really meaningfully help us get through this next couple of weeks and help us see the light at the end of the tunnel. I think also today people were hoping that there would be some easing of restrictions on outdoor recreational activities. We didn't see any of that again. So I think today's announcement was just really disappointing from the Premier.
What is your position on the Ford government's ban of outdoor amenities?
I think when we look at the recommendations from the science table as well as medical experts around the province, they've been saying that the risk of transmission is relatively low, and there are ways that people can safely participate in outdoor recreation. And, we're calling on the government to reconsider that and, ensure that people have access to outdoor spaces so that they can, also, one, stay physically active, but also this has a huge impact to people's mental health and well-being. And not everyone has access to a backyard or green spaces. And so sometimes getting out and participating in outdoor recreational activities is the only way that they can get that access to green spaces.
Do you feel like, I know in your ward, there's a lot of apartment buildings, there's a lot of condo buildings. So do you feel like your ward has probably suffered maybe the most?
I think, yeah, absolutely. It's a great point because in Brampton Centre in particular, we have a number of high-rise buildings and people who don't have access to parks and playgrounds. And so, I think making, spaces open for people to safely, participate in outdoor recreation is important. I've spoken to a number of youth-serving organizations as well who are very concerned that there aren't, access points for young people to participate in recreation to keep their minds and bodies healthy. And so there is a disproportionate impact, especially for lower income or racialized communities who don't have access to these large outdoor spaces.
How do you think the residents in your riding or Ontario residents more generally can best combat the spread of COVID-19?
Well, I think everyone has been doing their part as best possible. And I think, when we look at what has been contributing to the spread of COVID-19 in Brampton Centre and Brampton and Peel in general, it really is through workplace transmission. This is where we see the bulk of infections taking place. And this is, again, why we need to have, policies like paid sick days in place. And we need to be prioritizing the vaccination of essential workers. I think had we done that earlier on, if the government had followed the advice of public health and many experts who were calling for paid sick days and increased vaccinations to hotspot communities, we may have been able to limit the spread that we see throughout Brampton. In the area that I reside in L6Y postal code, we're seeing positivity rates well above 20% in our community. And this is because it's home to a large number of essential workers, for example, who are taking, the 511 Zoom bus into Amazon and getting sick. So I think everyone is trying to do their part, but the public health measures and the policies that were needed to help stop the spread of COVID-19 in our communities weren't implemented, and action was being taken far too late to help protect our community.
Which measures would you like to see the provincial government implement to better handle the pandemic?
I think, again, we've seen the government implement a paid sick day program here at a provincial level that really only provides workers with 3 paid sick days, and the program is still very cumbersome. So we're going to continue the call to action as New Democrats to push the government to ensure that there's a minimum of 10 days that workers can access. Isolation is required for 14 days. If you're sick, you have to be off for more than 3 days. The 3 days that are provided are simply inadequate, and I think aren't going to help us stop the spread of COVID-19 in our workplaces. I think the other call to action here is increasing our vaccine supply. We see pop-up clinics, happening in our community, but they don't have enough supply. So within an hour, they're completely booked up. And this means that essential workers who may not have had access to, vaccine hunters on Twitter weren't able to get that information and book an appointment in a timely manner. Or if they were able to get the information, it was a little too late, and then everything was booked up. So I think getting a greater supply of vaccines to our community will help us actually get people vaccinated, our essential workers, more importantly, vaccinated. Folks like our educators need to ensure that they get their vaccines as well. Additionally, I would have loved to see the Premier make a commitment to addressing the issues in our schools, capping class sizes, for example, improving ventilation. This is how we're going to get our schools open, which I know everyone wants to see happen. But in tandem, if those investments are not made to keep our students and our educators and staff in schools safe, it's going to be really hard for us to reopen safely. So I think that it needs to be a combination of so many things. And again, that's why today's announcement was so disappointing, because none of the measures that we need to keep our communities safe are actually being implemented by this government.
10 areas in Brampton to date are now among those with the highest COVID-19% positivity rate in all of Ontario. Does this number worry you? Why do you think that this is happening, and what can be done to curb the spread?
Again, I think it goes back to the point that, we have a very high population of our workforce here in Peel. More than half of our workforce, in fact, are folks that cannot work from home. And so when you look at the data in those hotspot communities, these are communities where you have large numbers of essential workers. You also have multi-generational homes and, areas with high-rise buildings, for example, where you have multiple people living in those homes. It's almost a recipe for disaster here in the Peel region because none of the public health measures and policies that we needed to help protect and address these underlying factors were implemented through the pandemic. It is very worrisome that essential workers, racialized essential workers, are being forced into this situation without protections. Again, I think in order for us to have a meaningful impact and stop the spread in our communities, we need to ensure that workers can stay home if they are sick. We need to ensure that they have timely access to a vaccine, both their first and second doses, and that we make sure that they have the supports that they need to prevent the spread in our community. Again, those investments were never made. That's why in many of our communities, like across the Peel region, we saw that schools had to be shut down earlier than other parts of the province because we are such a hot spot. So I want to encourage the government to do the right thing to help us to protect our communities, but they just continue to sort of neglect us.
What are your thoughts on the Ford government's handling of the COVID-19 pandemic?
Yeah, absolutely. And I think that's a sentiment that I hear across the city. When I'm speaking with constituents, they're really feeling as though we were neglected here in Brampton. When you think of the vaccine rollout, when the pharmacy pilot program was announced, not a single location here in Peel offering those vaccines through that pilot program. We know for a fact, as the data indicates, that Peel did not receive its fair share of vaccines per 100,000. Communities like Kingston in receiving a far greater number of vaccines, even though they had a relatively low community transmission rate. I think people want to know why that happened. Our essential workers who frankly were risking their lives to keep other parts of the province moving do feel neglected and don't feel that the right resources were allocated to our community. ICU doctors from the start of the second wave were very clear that we were going to reach a crisis point. The investments that were needed to keep our communities safe and help prevent this from happening were never made. So it's really disappointing, for our city of Brampton. And it's not just, myself as an opposition member that's raised this. I think we've also heard this from members of council, our mayors, who have been calling for bigger and better investments in our community and a more equitable share of vaccines. Those measures were never put in place to help us stop the spread. And so it started to spread like wildfire really quickly. And, to use the analogy of, when your house is on fire, it's not that you go 3 doors down and start putting out the fire. You point the fire hose exactly where it needs to go on the burning house. The province's approach was to sort of sprinkle water everywhere else and completely ignore our community. And I think people really paid the price for the government's inaction.
You have been quite vocal about how the Ford government has failed those in long-term care homes. What does the Ford government need to do in the aftermath of the Ontario Long-Term Care COVID-19 Commission report and the tragedies in these LTC homes? Where does the accountability lie?
Oh, thank you so much for the question. I think it's a really important one. I think one area that is most heartbreaking in terms of the impacts was in our long-term care sector. And, I think it's important to point out that, this is a sector that has been neglected for decades. And, when the pandemic hit long-term care, this really put things into crisis perspective for a lot of folks. And, it's the long-term care commissioner's report. It's the Auditor General's report. We also see through the military, the Canadian Armed Forces report, that there are some very serious systemic issues here, whether that's related to staffing shortages, the lack of infection control measures. These aspects were never addressed by this government once the pandemic started. The Long-Term Care Commission provides 85 different recommendations that, the government has not even yet committed to implementing. I think to start moving us forward, we need to start taking the profit out of long-term care. What we saw in many instances and still continue to see is that profit has been the primary motive, and which has compromised care in many of these long-term care homes. The staffing shortage, is really devastating because, PSWs, nurses, they are not being paid a fair wage, and many of the CEOs and shareholders of these for-profit homes are walking away with record-breaking bonuses after this pandemic, yet they refuse to pay their employees a livable wage. So I think that there are so many recommendations that have been made that the government can implement, and I think it starts with making sure that we make the pandemic pay a permanent increase for workers in the sector so that we can attract and retain PSWs and RPNs to the sector. It also starts by, I think, transitioning those homes from a for-profit model to a not-for-profit model, so that we can make sure that, profit isn't the motive and that care is what's driving those homes. It also means that we need to increase infection control measures. The SARS Commission back in 2013 made very clear recommendations on that. Unfortunately, the Liberal government did not act on those recommendations, and we see Conservatives continue to neglect the sector as well. So I can keep going on in terms of what needs to happen, but what's unfortunate is that there has been no accountability and no real commitment from the Minister of Long-Term Care or Premier Ford with respect to how they're going to fix the mess that we know is happening in long-term care.
I understand that you have criticisms about the wages of nurses. What would your government do to tackle this?
So, we have from prior to the pandemic been calling on the governments of the day to create a mandatory minimum standard of care for folks in long-term care. Right now, some residents are not getting the level of care that they need. So by creating a standard of care, which is a 4-hour minimum of hands-on care, that means that then we would address the staffing crisis to ensure that we're reaching those standards. I think, again, when we look at what's happening in the sector, these These are folks that are being employed through agencies. They are part-time. They are precariously paid in low-paying work. And so I think to address some of the staffing crisis, you need to pay folks fairly. You need to make these good-paying jobs, full-time jobs, so people will want to work in the sector and be able to support their families. I can recall meeting with PSWs even before the pandemic started, and many of them are working 2 or 3 jobs in the sector and then working outside of that in order to make ends meet. That shouldn't be the case. I think we have to fix the staffing ratios. We need to ensure people are paid fairly so that we can retain the staff that we need to provide the care for our elders.
Currently, doses of the COVID-19 vaccine are distributed 4 months apart in Ontario. This is despite the fact that Pfizer recommends 21-day intervals between dosages. Moderna suggests that the second dose be followed after 4 weeks. And the creators of Oxford AstraZeneca recommend between 4 and 12-week intervals between dosages. What do you think about the longer delay in between these dosages? Why is this happening, and what possible negative implications will come from this?
Well, I'm not a medical expert, and I think that what we need to do is follow the advice of, those medical experts and find ways to expedite the process in which people can get their second shot. We know that people are still susceptible to COVID-19 until they've received the second dose. And so, we are looking for ways and hoping that the government will shorten that time period so that people can get vaccinated. I'm just hoping that it isn't as slow and sloppy as the first rollout was. But I think there's a lot of concerns with the waits. I think there are homebound seniors, for example, who have yet to even receive their first dose of the vaccine. And so I think, the government has a responsibility here to clearly communicate to the public with respect to the extended wait period of the second dose and find ways to minimize this so we can more quickly and effectively fully vaccinate our population.
There's been many increased discussions surrounding the likelihood of an extension on the stay-at-home order from May 20th to at least June. What is your thoughts on the extending of the stay-at-home order? I know that they have just announced today that they're extending until at least June 2nd.
Again, as we discussed earlier, I think it's yet again another disappointing announcement. I think people are really looking for these lockdowns to end. I mean, we've had one of the longest lockdowns in the country, frankly, and it's been really frustrating. I think of small business owners who are struggling right now to keep their doors closed and keep themselves afloat. Many are on the brink of bankruptcy if they haven't declared so already. I really worry about what this means to our economy at a local level as well, with those small businesses being forced out of business, not receiving any supports from this government. And I think that's been the most difficult part of this for everyone is, we all understand that we're facing a pandemic, but for the government to continue to neglect, communities, small business, not follow the public health recommendations of their own science table makes this so much more frustrating and difficult for folks. And COVID fatigue is real, and I can empathize with that. I think we're all feeling that. But like I said, what makes this even more difficult is the fact that the investments we need in our communities are not being made. And so we see longer lockdowns and sort of this pattern. Another 2 weeks of a lockdown here, without any of the public health recommendations being implemented, does this mean that when we reopen, we may see more of the same? It's really confusing to people. I really hope that this will be the last lockdown. But I think at the end of the day, if the government is going to implement the public health measures we need, it's just going to continue to prolong this merry-go-round, essentially, that we're on.
Some small businesses have expressed the great toll that this pandemic has had on them and have displayed apprehension in regards to extending the stay-at-home order. What do you think should be done to ensure that these businesses are getting the support that they need during these difficult times?
I think from the beginning of the pandemic, it's as New Democrats, we've been very clear that small business needs support. It's been a very confusing time while, big box stores like, Costco and Walmart have been able to keep their doors open while small businesses have been forced to close them. And then in tandem, not receiving any direct financial support from the government. I mean, the small business grant, one of the big issues that my office is dealing with right now is small businesses who are not even getting a response from the government with respect to their application. So it's a really chaotic situation for many small businesses because, this isn't just a business. These are folks that are part of our community. It's not their business that's just suffering. It's also their livelihoods, their ability to take care of their families, to pay their mortgage, to put food on the table. There are serious, economic and financial consequences to our community because the government is not adequately supporting businesses. I've spoken to people in the personal care sector, folks that are operating gyms, folks that are in the trucking and logistics industry, taxi industry, driving instructors. The list goes on and on of businesses that are just at their wits' end because the government is not stepping up to help them weather this storm. And I can appreciate that frustration coming from a small business family. Your fixed costs are still there. They are not going anywhere through the pandemic, and they're piling up for many of these businesses without the relief, the direct financial supports that they need to help offset those costs, and then think of even what a reopening is going to look like.
Some critics of the Ford government have argued that the government has failed the people of Brampton, especially low-income and essential workers. During this pandemic, what is your take on the statement? Do you think that Brampton is alone in this?
No, not at all. I think, the sentiment here in Brampton, especially from our low-income racialized communities and others, frankly, in realizing what systemic discrimination looks like, it's very apparent that there was not an equity strategy in place from this government, something that New Democrats called on the government to adopt very early on in this pandemic because the data was clear. Racialized communities, not only here in Peel, but in for example, Scarborough and in Humber River Black Creek, these communities were being disproportionately impacted because these were, often racialized, precariously employed, low-waged employees who were being, essentially forced to go into work and getting sick. And so when you look at this in that perspective, you do realize that there is inequity in the system. Even look at how the vaccines were rolled out. Again, you see communities where there weren't large numbers of essential workers receiving larger doses. Folks were able to book a vaccine while working from home and be able to do that without ever missing a single dollar of pay. But for essential workers in communities like Peel and Scarborough, they were lining up for hours in the snow and sleet in order to access a vaccine. The whole rollout was just so inequitable and so unfortunate that this is what we see the government choose to adopt as an approach. I also, had a chance to speak with members of the ethnic media and press because they also have shared with me that, the government was not using them as a resource to communicate with the communities with respect to their own announcements and vaccine rollout. And so it just makes you wonder, why this type of an approach was applied, why certain communities were neglected. And I think also highlights that there is systemic discrimination built in to the approach that the government has taken here in Ontario.
Well, what kind of approach would you take?
I think when we looked at the vaccine, command table when it first came out, it was very clear that there wasn't, a strategy in place to reach out to ethnic communities, to racialized communities. And those were the communities that were the hardest hit. You look at making sure that there is a communications expert, for example, that would help us reach out to, a wide range of diverse communities. None of that work was done. And so I think from our perspective, perspective, applying an equity lens would acknowledge that those communities were disproportionately impacted by COVID and that they needed a greater share of vaccines and also support in terms of how we were communicating. I think the rhetoric that was put forward by the government was that these communities were vaccine hesitant. That was not what happened in reality. The moment that pop-up clinics were made available, we had people lining up and trying to get access to a vaccine. It was simply a distribution issue, that was inequitable because when vaccines were made available, racialized communities took advantage of those in very large numbers. And again, going back to the point that because we never received our fair share, many people were left without access to a vaccine because those communities weren't given the number of vaccines that they needed to actually vaccinate the community in an effective way.
Well, I know for your riding that vaccines can be distributed. People with the postal code in Brampton can go as far away as 100 kilometers as far as Simcoe County. So what do you have to say about that? Because unless someone's staying in their local area, maybe they're not able to access a vaccine. But if they just go maybe to the next city or a few kilometers outside where they do have this available, what are your thoughts on this?
I think we saw that with, the pharmacy pilot program as well, where, people were sort of crossing over to other public health units in order to access their vaccines. We had folks coming from Burlington into Toronto, for example, in order to get access. It just shows you that there really, I think, isn't the right approach in place. If you're giving communities who are hotspot postal codes the right amount of supply, folks don't need to leave their community to access a vaccine. And I think also, every resource that should have been deployed in our community was not deployed. Faith-based organizations, for example, indicated that there was a willingness for them to set up pop-up clinics, but they weren't being provided the resources to do so. I think folks in Brampton wanted to be able to access a vaccine in Brampton. They should not have to go to another public health unit in order to get the vaccine. We should have received our fair share here in Peel, and then that way people in our community could have stayed in their own community in order to access a vaccine. No one should have to leave their community to do so.
Now, I know that you're mentioning low-income workers, people working in basically factories or working in a very close proximity, being paid a very low wage. I do understand that the current government has a program where they're going into workplaces that are highly infected, and they actually have the vaccines available there. What are your thoughts on this?
I think it's a first step to help us get those essential workers vaccinated. It's unfortunate that, this didn't happen earlier because, this is where we saw the bulk of transmission and outbreak happening in our communities. So I think it's a good step that, workers are able to get vaccinated, but this doesn't help cover all the other workplaces that folks might be employed through. For example, if you're working in transportation or if you're in the taxi industry and not connected to one of these warehouses, you won't get access to a vaccine through them. And so, again, I think that what we needed to do was, in addition to some of the workplace pop-up clinics, is we needed to see more resources being allocated to additional pop-up clinics in our community so that every essential worker, regardless of where they worked, was able to access a vaccine in a timely fashion.
In previous interviews, I've spoken to the current government and they've expressed their lack of access to the vaccine. They told me they were selecting areas that they thought would curb the spread the most. How would your government distribute the vaccine?
I think there certainly were issues with supply, but I think ultimately, from a distribution perspective was where we really saw the government drop the ball. Again, the data is very clear that, communities with lower rates of transmission were getting higher percentages of vaccines than communities like Peel, who had very high rates of transmission, but were not receiving the same fair share in terms of the vaccine allocation. And again, that's why we have indicated and will continue to say that we need to follow the advice of the Ontario Science Table, who was very clear that there were specific communities that needed to get a greater share of vaccines, and that those hotspot communities needed to get, at one point the government was only allocating 25% of the vaccines to our community, for example. We were supposed to be getting 50. And then even when they increased it to 50% in terms of the allocation of that supply, that was still spread out over 114 postal codes when the science table recommended that it only be limited to 74. So I think taking a more concentrated approach would have helped us get a greater share of vaccines to communities like Peel, where we are a hotspot, and that would have helped us make sure that we could vaccinate our essential workers in our communities more effectively and rapidly. But what we saw the government do was distribute that supply to areas that weren't in outbreak, that weren't experiencing high rates of transmission, and this meant that communities like ours here in Brampton were neglected in that rollout. So again, as I said, I think when you apply an equity lens and you look at the data and you look at this from an evidence-based perspective, it was very clear where we needed to allocate the vaccines. The government chose not to do that, and so I don't think it's necessarily just a supply issue. I think we had a real distribution issue here as well, and a prioritization issue as well.
Thank you, MPP Sara Singh. You were watching News Talk with Julia Cosby at the International News Channel of TAG TV.